Wow, that was quite an engaging discussion. We couldn't even blink our eyes for a moment. So thank you,
Exactly.
Tanvir sir, Mr. Shams, and Rizwanul. So moving on, our next presenter, Mir Arshiya Zaman, former senior product manager at Escape, having served as a marketing specialist in the distinguished Bangladesh pharmaceutical industry. Her 8 years at Escape Pharmaceuticals Limited have been truly enriching. So, Ms. Arshiya will be discussing on the branding of an NSAID in a crowded market. The floor is all yours, Ms. Arshiya.
Thank you so much. Actually, after
Before
such a
we
great
start,
presentation,
Arshiya,
yeah,
we really wanted to know the timing so that we can just, yeah,
yeah,
so that we can say
yeah.
that you are having comfortable in the comfortable.
I am absolutely great. Thank you so much, Asya. Don't worry about it so much. But thank you for being so considerate for me. Before starting, I had introduction written here in my little notebook here, but all went up in a scrambled of words in my mind because Shams Bhaiya just gave such a wonderful presentation. Now I am really nervous. But to be
Don't be.
really honest,
You
I
will
would.
rock as usual. Don't be. Just go
Oh,
on.
thank you. Thank you so much, Ben. But to be really honest, I'm actually starting my session with a very lighter tone, but would like to take this opportunity first that Vivek sir, thank you so much for always keeping me connected to something that is really close to me, the Bangladesh pharma market or the pharmaceutical industry itself. Uh, but yeah, the former part in my designation actually aches a little bit now. But yeah, soon someday maybe I will be able to join this force again. But yes, the topic that I was given to, crowded market, the only key, I will be discussing 7 points, but the only key is to launch a brand in a crowded market is to find, just like the photo of the butterfly, find a difference, something that is not met the need yet, and you are giving that solution to that. You have to find that out, and you're all sorted for your challenges. So just to give a brief, my case specific was to launch a generic, which was aceclofenac. And to be the hypothetical situation is here is to be launched as a 15th brand of the market. So it's we all know it's a chronic painkiller. It is used for rheumatoid arthritic, osteoarthritic pain conditions for those such treatment. Little facts that I would highlight and want you all to have in your mind for launching of this generic. That rheumatoid arthritis, we all know it's a disease of that it's an autoimmune disease that affects the joints basically. And if I say it in a simpler words, it's going to make your movements feel like hell. If you have rheumatoid pain or arthritic pain, you know it. It's going to make your joints feel very stiff, and it's a very bad, crucial pain. Right about now, about around 8 million people worldwide are living with rheumatoid arthritis. And among those is like 70% are women. And mostly these disease affects aged group of people, like 55 years and above. Those are more affected by this disease. Just remember that part, because in my launching presentation, that helps me to classify the section of patient that I want to serve as a 15th brand, and I want to achieve my goals. So what are my goals? If I'm launching my brand in a segment, in a generic segment where already there are 14 brands are present, what is my mission? My first and foremost mission would be whichever class of doctors I'm selecting, my KOLs, whichever segment I'm selecting, my brand has to be the top of mind brand for them. And the term that I stole from my learnings back in 2018 from Vivek sir is make it a darling brand for the prescribers. My darling is someone who can never ignore you and always beside you. So make this brand something that your prescriber can never ignore, because the market has already offered him 14 brands. Give him something, make it in such a way that he prefers your new brand over those 14 brands. If I have a quick analysis of the painkiller segment, the Bangladesh pharma market, it is almost 1,575 crore worth market, the painkiller generics with 77% growth. And surprisingly, aceclofenac is the third generic, being a very old molecule, but still it is the third generic of this segment, and it has a positive growth in last quarter. And if I go for the analysis of the prescription market, the surprise that hit me here is being a very old molecule, and for the treatment of arthritic pain or chronic pains or complicated pains, we generally nowadays have a lot of other options. Like we hear about etoricoxib, we hear about diclofenac, we hear about nabumetan being more safer option, being more modern generics in this segment for this disease. But still, in terms of prescription count, aceclofenac is the #1 generic of all the generics, which are generally taken as the new generics. Who are prescribing? I've shown a pie chart here, orthopedics institution, like almost every segment who are there possibly present in the RX scenario, everyone has the potential to prescribe aceclofenac. So now comes my first point of my 7 points, selecting the segment. And here this young gentleman is giving us the right suggestion not to be greedy. Aceclofenac being a generic which has the potentiality to be prescribed by every class of doctors, you can have one mindset as a 15 brand when you're launching that everyone is writing it. So everyone can have that opportunity to write this prescription. So I'll have a very generalized promotional plan and go to every and each doctor and say, we are as a company have launched this generic. That can be an easy approach, but it is not going to give you a long lasting result. If you want that your brand becomes the top of mind brand, your brand becomes a darling brand and rises itself up the ladder, being launched as 15th. If you want to become top 5, then you have to go selective first. You have to find your segment, you have to find your disease where you want to promote, your patient group, and find the segment accordingly. So for my presentation, I have chose orthopedics, medicine, and rheumatology. Rheumatologists in Bangladesh pharma market, in Bangladesh medical segment, we all know that there are about around 200 altogether rheumatologists are there. So covering rheumatologists is easier. But if we talk about orthopedics and medicine as top KOL segment, it gets a little crowded again, just like the generic, because there are a lot of orthopedics and medicine. They look after all the possible diseases. So are you going to cover a lot of orthopedics, all of them with a general promotion, or you want to go selective? Or which selective? Have that narrative very clear. Find your niche and go for niche on the basic. Because when you're planning first you're launching, have a KOL segment and have a mindset that these doctor count will all have to prescribe my generic and have to prefer my brand as top of their mind. So for just example, I have set a number here that I will cover 500 medicine specialists, especially who looks after the patient who are older, because that point that 55 and years above patients actually have that disease. So we will cover those medicine specialists to whom older patients are more crowded, like buzurg log zyada jate hain. So I will cover those medicine specialists on the priority basis. Then I'll go to the next phase, next set of medicine specialists. For orthopedics, it goes for the same segment. And initially, my budget allocation as a launching brand, always keep in mind that you will be given a budget and it is always on the brand manager or the person behind how you're going to allocate your budget and where you're going to put your money to get the ROI. So your prime group of doctors, the selective ones, should always get the first priority. So let's not get greedy. You can have a generalized promotion, like you can have a generalized literature, sample, or just pen promotion, small token gifts, or PR group discussions for all the institution, GP, RMP, neurology ones. You can have a general information giving, like, yeah, I am there, I'm new brand, I've launched this. You can have a generalized plan, but first and foremost, you have to create your own base. You have to have a selective KOL segment as per the class you have selected to serve. Number two, know your brand like a back of your hand. Every part, every bit of the brand knowledge, what your generic does, what is the dose, what is the convenience, what is the new technology at this point going on in the world, what are the new studies they're going on. Try and learn and gather all the information in before your launching phase, because this will get you to the point where you can find the launching campaign's niche for your generic, for your brand. Because when you it's a painkiller, it will relieve pain, but with alongside, if you like echo the voice of the 14th brand, they're already present. If you say the same thing, same information to the doctors, they already know it, you're not adding any value. So as a 15th brand, when you're joining the club, you have to give them something new that there, it was there probably, but nobody said it. So when I saw that cyclophonac is the #1 generic in prescription, it was like, if etoricoxib is more talked about and more hyped, nabumetan is considered as the safest, why cyclophonac still is the #1 generic? Because it has a uniqueness to itself. It is the only painkiller in the arthritic pain relieving segment, which also enhances and plays a positive role in cartilage regeneration, which is very important for the patient who has arthritis. It gives them an added value. So for this purpose, and for my launching campaign, if I'm doing this, I would choose to highlight this part, that my brand, this generic gives you pain relief, plus it promotes cartilage regeneration. Now, the third part, giving a name, something that will stay with your brand forever. And it has to be something that connects the heart and the mind of the doctor. Something that is always easy for him to remember, for the prescriber to remember and write. It is better to have something which has highest 8 letters. Within the 8 letters, the shorter the better, so that they can write it easily, memorize it easily. Is it far more better if you can connect the brand name with the campaign or the niche that you have selected, or the information that you have selected, to connect with it as well, so that every time your colleague goes to the prescriber, can connect that dot for the doctor, and it creates a brand reminder. And secondly, it is like the bang on thing. Like, it would be the best if you can have the brand name in a language that's community language. Like for Bangladesh, if it could be something, a Bangla word, which is very easy to remember, that connects is immediately. So I couldn't be that what should I say, creative, but I got this one for this selection, FlexiGen. It is the combination of flexibility and regeneration, because I want to promote in my campaign that my brand is promotes flexibility to your patients and also helps in regeneration of cartilage. Now comes the fourth thing, campaign which puts your brand in the top of your mind. Again, when you are able to find a problem that your patient is facing and giving a solution, that makes the best campaigns. So find an unmet need, because you are the 15th brand. 14th brand has already had, they have spoken their part. What they are not saying, you have to find that out. Make it something that is a need and give a possible solution through your brand. For me, this could be flexibility. That could be a need, because the patient segment here are old people who have served their entire life, worked for their children, their families, and now at this age, when they want to enjoy life with their family, they are suffering because of this disease, this brutal situation, which is rheumatoid arthritis, and making their life miserable hell. We all know, if it's arthritic patient we have in our home, or we know someone, in the morning when they wake up, it takes them about 10 to 15 minutes to move, because in the morning their joints are so stiff and it hurts so bad that they cannot move easily. With any situation, if they're sitting and they want to get up, if they're walking way too long, it hurts their joints very bad. So in this, these are the situation makes their life very uncomfortable. They cannot go walk with their children, or they cannot go play with their children's child. They can't do that because they are in crucial pain. Their life is not flexible. So my product will remove that pain from your life, make your life more flexible, and also give an added benefit, which is cartilage regeneration. And probable co-prescription possibilities that we know in Bangladesh market. There are few combinations, glucosamine, chondroitin sulfate, glucosamine, and other combination, which promotes cartilage regeneration. And in arthritic patients, they are prescribed with these, because for arthritic patient, cartilage regeneration is a big important factor. So this product, but that medication doesn't remove pain. I need to remove the pain as well. So aceclofenac can be put in the same prescription as well, so that it removes the pain, also gives the added benefit of cartilage regeneration, and the cartilage regeneration prescriptions are also there. Also, some doctors, for very critical, complicated pain, chooses to prescribe 2 painkillers in one at a time. The second one, the common one, is aceclofenac. So there is this opportunity as well. Fifth is adding value. Add value to make your brand very special. Up to the number 4 points that I've discussed so far, I have been adding value of the generic itself. How aceclofenac is a better generic. What is that untold information that still the 14 brand haven't spoke about? I gave those part, but about the generic. What about me? Me being the 15th brand, I have to add some value as a brand. Which different, this is going to make the actual difference. So that can be in terms of formulation. It can have some kind of disintegrating agent that works so fast that you will get faster relief. It can be a formulation, like in PPI segment, we have seen a drastic change with MAPS formulation when it was introduced. So if in international market, there is something that is available for aceclofenac formulation, which is yet to be launched in Bangladesh, can be added, that formulation can be added here. You can launch in that formula. Packaging and product presentation. In general, all painkillers all the available brands are in white color tablet. Very basic. Every tablet basically is white in color, small round tablet. What if I make it a joint shaped tablet with a pinkish hue or different color? Make it what if I present it not in a strip but in a jar, if the formulation allows me to do, if the there is a valid formulation present, like to present it in a pot or in a jar. What if I can do that? Maybe that's not possible. Let's make alu blister, not alu PVC blister. Make it something more protected. Give it a protective sense. And or since arthritic patients have long-term prescriptions are going to go there, because it's not going to be like 1 week or 2 week. It's going to be a long-term prescription, because these pain take time to be controlled, or patients is prescribed. So they're going to buy, if I make a 30s pack or if I make a 20s pack, the patient will, because twice daily dosing, the patient will, there's a possibility buy the full pack. What if I add a QR code or a leaflet inside the pack of very basic exercises that will help with the pain? So these are the things that will add value that other 14 companies are not doing, but I am doing as a 15th generic. and trying to act like a darling brand of the doctors, the prescribers. It is all about doing having a patient-centric approach, which is my 6th point. Having a patient-centric approach, showing that you care about the patients, and that is what will drag your main customer, the doctors, because they care about their patients. So as a brand, when you show that you are catering towards the patient, the doctors are bound to be attracted to you. So having a patient-centric approach to your promotional plan is now it's the key. This is because nowadays that's the only key. You have everything. You have let's say you have tick marked all the things, like you have great formulation, you have great approach and everything, but you missed that to describe to your prescriber, the doctors, that how it benefits their patient. It would never click. So you always try to connect these two, like your patient needs this, and I am giving you exactly that for your patient through my brand. So patient-centric approach is a must. And have also, you can when you enter it, that is my personal opinion, when I'm entering in a market which is already crowded, I have to have a louder voice, because I'm already a 15th brand. So if I want the prescribers to hear me, I have to have a louder voice. I have to do something which is bigger, which is larger than something they're usually done. So patient-centric groups is something that would be very outside of the approach and very philanthropic, very giving. It's going to benefit the patients, because chronic pain condition patients, they are suffering for a very long time. And this is something, their sufferings, when they're sharing with someone who is going through the same process, they learn a lot from each other. You're giving that platform to them. And when there is a doctor or a prescriber added to this platform, they are getting extra attention from a prescriber, from a professional, what to do and what not to do about those things. Because it's very easy, very common. Like what every doctor, when they in their chambers, they have every day 40, 50 patients waiting for them. So it's very natural, very human. He wouldn't be able to give each and every patient the same, all the suggestions that he wants to give. Maybe something is left out, or something he couldn't give because of the time. If I have a group, if I introduce something, this support groups, and if I get 1 or 2 different prescriber to speak about, if they come and they share, and the patients are sharing among themselves, it's creating environment, a platform for both the parties, and both are being benefited. And it's philanthropic. Directly, you don't get anything out of it, but you are getting an image of your brand, that your brand promotes and your brand cares for the patient. Patients are getting that approach from you, and the doctors are seeing that, yeah, this brand, this company's this brand acts for us, talks on behalf of us, for my patient. So of course, that will get you the support. And 7, being consistent is the key, because when you come late in a market, at times you will feel that tiredness, you will feel that pressure, because we are all human, that maybe we are not going to get the results. Trust me, if you be consistent with your efforts, and if you try to give something new, try to add value, and be consistent with your prescribers, with your KOLs, you are bound to get the results. So always be consistent with your efforts, and try to have the same enthusiasm, try to promote the same enthusiasm, give the same enthusiasm to your field force, because they are the one who are your spokesperson on your behind you, because you can't always go to all the doctors. Your field colleagues are going there for you. So always value your field colleagues. Make them believe, make them part of the journey that this is something special. This is not just a painkiller. For this instance, this is not just any other aceclofenac brand. This is something that cares for each and every arthritic patient, understands their pain, and tries to give them something larger, something better. Let them have that feeling within themselves so that they feel proud that yes, I am late, I am 15th brand, but I took this time because I want to give your patients something better. This is my better, so that they feel that and they share it with more confidence. And you be consistent, never lose hope, the results will follow. So with that note, believe in yourself, always try and have that faith in yourself that you can do it, then of course the results will follow. And being you always works like magic. So that would be end of my slides. I hope it was
It
something
was
better than
it
nothing.
was
And
impactful, and we can say that it was a powerful and impactful presentation, and it was very lovely. Thank you so much, Meerashya. Thank you. And with that,
thank you.
with all that, through targeted digital campaigns and collaborations with healthcare and influencers and everyone in the company successfully positioned NSAIDs or any other drug as more than just a pain reliever, emphasizing its role in enabling individuals to lead fuller lives. I think the impact of the presentation will be there for quite some time. It was wonderful. I would like to ask the audience if they have engaged in the exchange of questions. Any questions, guys? Or it is like, okay, fine, everything is solved. It was such impactful that they will be taking, okay,
I
yeah.
think I think
It
that
was a wonderful presentation, Arshiya, and I
Thank you.
love especially the patient-centric approach which you have taken. That's what is really required. I shared with you a little later. Last year we had a session on the pain points of the uh, patients with arthritis.
Patience, arthritis.
Shazia, do you remember that? That lady
Yes,
from
sir.
Bangladesh, she had a
Yes, sir.
difficulty in the.
Yes.
Can you share with Arsha and the others who are
Yes.
interested? That was, an eye-opener for many on the pain points of an arthritis. One did not even realize that even visiting a toilet, Indian style, is so difficult for a arthritic patient. So these are the points
Exactly.
which can be covered in the patient-centric
Marketing.
activities. And especially the point which you said, speak to
Exactly.
patients like me. These are the points, these kind of these kind of patients would not like to speak to their son or daughter or parents. They would like to speak to somebody like a patient like me. That's a wonderful point you raised. Thank you. Thank you so much.
Thank you so
Yeah.
much. This is everything
Shams,
that
you
I've
say
learned from you, actually. Shams, yeah.
I just wanted to say Ashia presented really well. I told you, she's more experienced in these things than me, and she has done extremely well. Um, and I could relate a lot of things she was saying and how we actually go to certain aspect of branding the product to the customer, and how the field force are so important when this kind of overcrowded generics are being put into the market. So I really appreciate how she has planned it. She has done it in Escape as well. So well done. And thanks to Pharmastat for giving all of us a chance.
Thank you all of you for giving us all the insights actually. And Sunil sir has been here and I think he wanted to share something. Sir, yeah, you have raised your hand. Can we ask him to give the permission to him? He has raised his hand. Samir, can you please? Yeah, you
Yeah,
can
yeah,
unmute.
yeah. Uh, Am I audible?
Yes, you are.
Yeah, I just wanted to know one thing that nowadays most of the companies are claiming that we are giving different technologies, especially I'm talking of gel, nanotechnology. What is the difference between the normal gel and the nanotechnology gel? Does it got any advantage over the normal ointments and gel forms, especially in rheumatoid arthritis and uh, this arthritis patients?
For that, do we have anyone who have the expertise on the same and can enlighten Sunil sir on that part? Anyone from the speakers and from the audience are more than welcome with them. Vivek sir, any enlightenment on words on that? I believe that says that right now the expertise holds down with the brand management only, and with this,
No problem.
maybe we can, this question we can personally talk to you about little
No
later.
problem.
How about
No
Pharmacy
problem.
Academy?
She has explained everything very well.
Okay,
My regards to her
sure. Thank you so
Thank
much,
you.
regarding the
and
brand management and everything.
yeah,
Thank you.
thank you for being a part of World Pharma Brand Managers Week.